Uganda has a high prematurity rate. Over 200,000 babies are born preterm every year. Whereas there has been significant progress in reducing mortality of these newborns, some 65,000 are lost every year. 30,000 of them are neonates.
But unfortunately, almost now coming to 40% of children dying before 5 years, just in the first month of life. And those are mainly neonates dying. It is estimated that over almost 30,000 newborns are lost every year. But this excludes another 35,000 stillbirths.
Apart from stillbirths, preterms and full-term babies require breast milk, which is regarded a very important intervention for provision of nutrients important for a baby's growth. However, some of them are unable to get it because of various reasons, including death of the mother or the mother being unable to produce adequate or any breast milk, among others. As an intervention, Uganda launched its first human milk bank in November 2021 to provide breast milk to preterm, low birth weight and sick babies. The bank, hosted at St Francis Hospital Nsambya, is the second in East Africa, with the other being in Kenya.
The milk bank is important for two major categories of newborn babies. Both of them underlying is that they are not able to breastfeed. So might either be a sick newborn, might be a term baby but sick and is not able to breastfeed, or sometimes preterm babies or abandoned babies. And the early start in life is so important for our development. If we don't start well early, then it affects us throughout life.
One of the key things that improve survival of preterm babies is nutrition. And the nutrition which has everything to make a preterm baby survive actually is breast milk. And many times we'd get mothers here who have like 3-4 babies who are born at 28 weeks. So that mother cannot provide sufficient milk for their baby. So that is when we started having this idea of having the human milk bank. Actually, it started maybe 8 years ago. The first experience was a mother who had a hepatitis B. She was acutely ill. So when her sister started donating milk to the baby survived, and actually the baby was discharged. That was in 2015. In the beginning, even the health workers, the staff were like, hey, but Dr. Vicky, how can we do something like this? So when they saw that success story, many people started changing.
The milk bank aims to provide a ready supply of safe, pasteurized human breast milk donated for preterm babies and neonates whose mothers may be unable to provide adequate breast milk. They get milk from potential milk donors.
A potential donor is any mother that is breastfeeding, but that mother must have sufficient milk for her baby, and then she must be healthy. She mustn't have HIV, no syphilis, she mustn't have hepatitis B or C, and she should not have tattoos, and shouldn't be taking a lot of what? Alcohol. She should make sure that she has enough milk for her baby, and once she has enough milk, then she can qualify to donate. So any mother that is breastfeeding, actually from 1 year up to 2 years, we accept that milk.
For my first child, I had a lot, so whenever I would be on duty, I would come here at around midday, because midday it would be enough to donate. So that by evening, when I go back home, my child already has enough to take when I go back home. So even this time, it's what I've been doing. Midday, I come, I give, then I go back and work. By evening, my child does. As long as you eat enough, by evening you already have what is enough. Before I started donating, I first shared with my husband. So he was fine with it, he didn't resist. He only told me, you see a child having a character of different, not having the mom's characters, having different characters. So that thing made me funny. So I was like, okay, people have that also, that mentality. But he was totally fine with it because he knew I was struggling with it.
I was inspired to start donating milk because I had a premature baby. So when I came to the bank one time, I saw the children who were here. My child had outgrown the baby unit, but when I saw the children that were here, and some of them were premature, some of them were sick, I just felt the need, yes, because I also needed milk at one time.
Albino mothers can still also donate because there is no association between albino and human milk. A mother who is albino can also donate. And then those who are also not on medication, like if they're on anti-cancer drugs, there are some also drugs which are where people are sedated. And then there are also these mothers who are taking what? Is it sushi? Those things. The drugs, those what heroin, those ones they can't donate. Yeah, they can't.
And since 2021, several babies have benefited and improved their life.
Our survival of preterm babies is about like 94, 95. But I think all our preterm babies feed on human milk.
Konsi Oyo is taking care of the daughter's baby who died after giving birth. Oyo is one of the many beneficiaries of donated breast milk at Nsambya Hospital.
Yeah, I can see now my baby is growing and energetic. He's moving and I'm happy with that. The first milk is most important for the babies. So I really love so much. If those who have with the good heart, you help each other.
The fight's not bad, it's good. My babies have been receiving it from day one up to date, and they're healthy, they're good, and they're gaining weight on that. And the milk is very, very okay.
However, there is a scarcity of information on the acceptability of donated human milk in Uganda. Nsambya hospital staff undergo continuous training on how to deal with the donors and, most importantly, storage of human milk.
Because we work with the hospital, we have staff that have been, whose primary role actually is to do the process of identifying donors. So there have been nurses that have been trained into lactation support and in human milk banking.
As we are talking to them, we are creating a good relationship. Then you can find someone who is having excess breast milk. You can see when the breast is engorged. And the mother even can tell that, hey, my breast is full. So you should talk to that mother, please, going to us that milk. We're going to give it to other babies who are not having mothers, who are preterm yet, since their mothers are not having breast milk. So if the mother agrees, you come with the mother to the breast milk bank. We have the area of reception where we counsel them. So you first talk to her again, because remember, everyone needs the privacy. Since we picked them from a large number of people, we come with them to the reception. We talk again about the importance of breastfeeding, importance of breast milk. Then after, we take them through a questionnaire, but before they have to consent that no one has forced them to donate breast milk. After receiving the milk here, we have our computer and a printer. We write the name of the mother, the date we have received the milk. Then you calculate from that date up to 6 months. So you have to indicate the expiry date, the time you have received the milk, and the volume you have received. Then you keep it there in the fridge. But in the received book, you have to put there a number of the mother, because we don't want to say that, then you say it could be Carol donating milk and the baby, Barbara's baby is receiving Carol's milk. If Barbara says that Carol is giving my baby milk, there can be some wrong.
So once the milk is donated, we have a special expression room where they go for privacy, and we also have special pumps where mothers can express milk faster, because sometimes these mothers have come and they want to go back. So we have our special pumps where the mothers can express milk very fast, and once they have expressed the milk, they get the milk, they put it actually in a freezer. They freeze it immediately to -18. The essence of freezing the milk, once you freeze it, is also another process of killing any bacteria that actually this milk should have. Once we have been able to freeze the milk and we have sufficient amounts, we pasteurize the milk. We have a pasteurizer that it needs about 36 bottles. So we pasteurize the milk. Once the milk has been pasteurized, we also get a sample from the pasteurized milk and take it to the lab, and we also do culture on the milk. We only pass out milk to the mothers or to the babies if they have not cultured any organism from that milk.
We have received 96 liters and we have dispensed 76 liters. And now we have 20 in the fridge.
Despite the progress and successes, the team acknowledges challenges faced by the breast milk bank.
The biggest investment in the human milk bank is the equipment. We find that laboratory testing has already existed anyway. And we also find that staffing doesn't require too much specialized training. We had our staff trained by staff from Kenya because we were the first bank in Uganda, so we had to benchmark with St Hospital. And that training did not take more than a month because it's easy to transfer the skills that are necessary to run the bank. The biggest requirement are the equipment that go into the bank, because you need a pasteurizer. It's similar to milk that we take for consumption as humans. So you need a pasteurizer, you need fridges, and then so most like the room where the milk is kept and so on. So there's an investment that is there, and we've actually costed it. And this kind of investment, we think that we will advocate for government to at least create regional banks. The same methodology that was used for blood bank can be used, because then once you have central banks, the rest of the products run themselves. That's the milk itself, it will come from donors, but also the staff that run, those are maintained on regular salaries. There's no specialized skill that is required here.
When we first fundraised in the year 2017, we got about 20 million. And even many other people came in to help us. Different people in academia, they really came, and I think each of them was buying an item. They started funding for the process of initiation of the bank in the Nsambya hospital. Yeah, the bank is quite expensive, and it's quite expensive actually. It is something that it costs us about, let's say, 500 million shillings. The main challenges are basically where donors wanting money, and then the other challenge actually that we have is the fact that when we get our mothers who are able to donate here, some of them don't stay for a very long time. They stay for 2 to 3 days, 4 days, and then sometimes they go home. So the other thing, some of them will just want transport. So it's something maybe we need someone else out there can help and provide transport for these donors, because you can find a mother that has been giving us a lot of milk, but once her baby is fine, after 4 or 5 days, she's going to be discharged. And then of course maybe also facilitating transport from other units that can be able to come and also donate.
There is a cost on testing, because the number of tests that we do range. Let me give a price that maybe range about 200,000 shillings, where we have to test that donor for a number of conditions before they are ready to donate. And right now that cost is quite a hefty cost to the person, that's the recipient or the parent to whom the baby is going to be given. And this is the problem. After we've tested, we could test and the person fails the test, then have to pay for a second person to test. So there is a cost that is still heavily borne by family, and we think again, if the Ministry of Health can look into subsidy for this kind of testing, as again happens when we're doing with blood donation, because the similar tests we do for blood donation are what we do here in human milk testing.
As efforts towards expanding this investment continue, the need for a policy to streamline operations is key.
One, a policy is important, and the enabling laws are good enough. I think a policy was passed which is around donation of biological products and tissues. I think it could cover most aspects of a milk bank. But definitely we need to adopt that law which was passed to a milk bank. Without it, then there can be a lot of problems even for the people promoting a milk bank. Because if, let's say, somebody gave a child breast milk which is contaminated and the baby gets sick or dies, then whoever is giving it will not be protected. So we need a policy. But also policies are the basis for developing programs and guidelines. So we need a policy. Number two, we need standards. because if we don't define the standards, then it is problematic. Right now, the number of places where they're trying to establish milk banks, especially here in Kampala, but without standards, then it is problematic. Standards are needed in how do you collect the milk, how do you even treat the milk, how do you distribute the milk, how do you give the milk, and those kind of issues. Then 3, we need the financing. Financing is so critical, as you know, and then also we need to sensitize the public, because the milk has to come from people, and people must be willing to donate. And even those who are receiving must be willing to accept it, to know that it won't do any harm.
St Francis Hospital Nsambya has since taken up the initiative to popularize the human milk banking idea across other facilities.
So we are now a set of 5 hospitals. We put Chibuli Hospital, we put Naguru Uganda China Friendship Hospital, we put Mengo and Lubaga hospitals.
The Uganda Ministry of Health has developed guidelines around human milk donation or human milk banking and is looking at scaling up human milk banks countrywide.
We are working now on a document on how to standardize this breast milk. We need to look at, for example, how can they be established? And establishment is not only the infrastructure, it also involves what do you put in place beforehand. We must have people who can handle these systems, but also we must mobilize the communities, the potential people who bring the breast milk, and also sensitize the mothers who are going to use this milk, So we have a guideline, we're working on a guideline now which can help us to know how to establish them in the different places, what are the standards, what equipment do you need, what kind of data do you need to keep in these places, and then also plan how to implement the breast milk bank, including putting in place systems for monitoring, but also linking them to the service delivery points. And we are also planning to expand these breast milk banks. We have 3 potential sites now we are looking at in the region. And as I said, our biggest target is these small premature babies. It's and its conceptions about breast milk from any mother. So we need to educate the societies and the beneficiaries and also the donors about the safety of this milk and how important it is. So I think that's another challenge we need to do, and it has to be a continuous process so that it will be a shame for us to have these banks and we cannot get donors.